Hi, I'm Dr. Bree, Doctor of Physical Therapy, and today I have some really important information for women about prolapse. So I'm going to share some tips and some exercises to kind of get you started if you have or think you might have prolapse. But before I get started with that, I just want to tell you the very important disclaimer that if you have or think you have prolapse, it's important to talk to your healthcare provider so that they can properly diagnose you and determine how far advanced your prolapse is. Having an individualized diagnosis is really important so that you know what to expect and what to hope for as far as treatment outcomes when you are using conservative measures such as exercise and lifestyle changes. In some cases, the prolapse may be advanced enough that you're going to require surgery or use of a pessary, which is a device that you can insert into the vagina to help support the pelvic organs. If you're watching this, you probably already know this, but quickly, prolapse is a condition which is actually quite common in women where the pelvic organs, so this could be the bladder, the uterus, or the rectum, descend. They hang a little low and they press into the vaginal wall or can actually descend out through the vagina in the case of the uterus, or the top of the vagina, the vaginal vault, if you have had surgery such hysterectomy to remove the uterus. What you may feel if you have prolapse is a feeling of heaviness or a feeling that something's just not quite right in the pelvic area. You can feel pressure that increases as the day goes on. You can feel a bulge in some cases. Again, it really depends on how far advanced your prolapse is, so that's where seeing a healthcare provider, a doctor, a women's health physical therapist, your gynecologist is a great place to start, midwife. See somebody who focuses and specializes in pelvic health, and they can help you determine whether you do in fact have prolapse and how far advanced it is. Let me show you a very important tip to get started and some exercises that you can use straight away. So the first important key message is about posture. And I know that posture is not always the most fun and exciting subject to cover, but it's really important. Your alignment has to be spot on in order for your pelvic floor muscles and core muscles to fire appropriately and to support your pelvic organs. And when your core muscles are not in the appropriate positions for optimal firing, they're just going to be weak and sloppy. You want them to be nice and on so that they're supportive for your pelvic organs. The other key is that if your posture is slumped or funny in a certain way, usually slumped, then there is actually a lot of downward pressure, down, on the pelvic organs, which can send them right on down through the opening in the pelvis. So when your posture is slumped, like this, there is a direct downward route for your pelvic organs. When your posture is upright, the downward route is not so straight down. There's not an opening straight down below you. It's more at an angle. The opening is more at an angle, okay? When you're slumped, the opening is straight down, allowing for a descent, an easier descent of the pelvic organs. So we don't want to slump. Now, what I want you to do when you're thinking of your posture is to, first of all, start at your feet. So your feet should be pointing ahead, not out to the side. Your weight should be shifted back over your heels and not hanging forward over the balls of your feet. Shift it back. Your pelvis should be nice and neutral. Don't tuck that bum under, like we just talked about. So neutral pelvis. Then feel your ribs. Are they popped forward? That can happen. So if that's happening, pull them back. That's going to help engage the core muscles appropriately. Now your chin. Is your chin tucked forward? When your chin is forward like this, again, it's really hard to maintain ideal alignment of your spine. So you want to pull that chin back. So your head is stacked over your shoulders, over your hips, over your heels. Nice, tall alignment. I like to think of it as a zipped up position where your head is tall, you're holding your head like a queen. So again, no forward head, no slumped posture, no bum tucked under, nice and tall and lifted. Experiment with that right now. Try it and see how much better it feels for your pelvic floor and that prolapse to have that nice tall posture. So this is something you can do all day long. Let's transition to the floor, and I want to show you some important tips and exercises that you can start doing right away. All right, so you will need 2 pillows and an exercise ball or a kid's ball, like a playground ball. Most of us who have prolapse or think we might have prolapse have children, although it's not exclusive to women who've had children. Even women who haven't had kids can have prolapse, but it's very common among women who've given birth. So you might have one of these playground balls lying around. You can also, if you don't, you can also use a yoga block, or you can use a small pillow, kind of a firmer pillow. Again, this is information that I'd like for you to use right away, but I want you to use it either in conjunction with seeing a physical therapist or a healthcare provider who can help you, or I want you to be quickly seeking out that help so that you can get the proper diagnosis for your needs, because every woman is so different. I really can't make general statements for everybody, but this is a good place to get started. So the first thing you're going to want to do is lie down with your hips up on some pillows or something to prop your hips up. So I'm going to do that. My ball is getting away from me. You're going to come down and very carefully come onto the floor, because the last thing you want to do is jackknife up or down when you have prolapse. That can put a lot of pressure on the pelvic area, pelvic organs in the pelvic floor. So come onto your side and come down, or you can lift your hips up and shove the pillows underneath. So in this nice position, you should feel very supported, and in this position with your hips up on pillows, you can see that gravity is helping to kind of pull all of my pelvic organs back into their rightful place. So it allows you to take some pressure off the pelvic floor muscles. It's a very relaxing feeling. It's a nice position just to rest at the end of the day, or if you ever feel a lot of pressure on your pelvic floor, just stick some pillows underneath your bottom and prop your hips up. You can also bring your knees apart if that feels comfortable for you. If you're not too tight through here, you can bring your knees apart and just kind of, again, open up that pelvic area, pelvic floor muscle area. Just relax and open it without feeling like that downward pressure is making you uncomfortable, because again, gravity is helping pull all your pelvic organs back into place. So the first thing I'd like for you to check in this position, either knees up or down if that's comfortable for you, is what is going on. Check in with yourself. What's going on with your pelvic floor muscles, your Kegel muscles? Are you able to do a Kegel in this position? Are you able to squeeze and lift your pelvic floor muscles, pull them up and in, like you're stopping the flow of urine, or like you're pulling a marble into your vagina? Are you able to squeeze and lift those muscles? And then the key, are you able to fully release them? Are you able to let them go? And it won't be like a bearing down, but it will be a letting go so that you feel totally released and relaxed in the pelvic floor. Can you feel that? Sometimes women with prolapse tend to keep their pelvic floor muscles really tight and clenched all day long because they don't like the sensation. Who would? Of a heaviness and a falling of the pelvic organs. And so their pelvic floor muscles, which should be supporting the pelvic organs, are so tired because they're constantly clenching and trying to keep everything in. When your pelvic floor muscles are clenching all day long, it's going to lead to pain, discomfort, tension, fatigue, and they're not going to be able to work effectively to do the job that you want them to do, which is to support the pelvic organs. So you want to be sure that your muscles are able to, in fact, relax. So check in again with yourself right now. Maybe your feet can be a little bit wider. Try to do a Kegel, a squeeze and lift, and then see if you can fully release. The release will be a little harder to feel when your hips are up, but you should be able to feel that they have let go and relaxed, that you're not holding on to tension, either in the buttocks area and the sort of around the anus, or the vaginal pelvic floor area. That's where the pelvic floor muscles surround, is the anus and the vagina. So you want to feel that those areas are able to release and open. So check in there. Now, if you feel that you are not able to release the pelvic floor muscles, then I actually want you to not do Kegels, because you may have thought to yourself, well, if I have prolapse, then I've got to do Kegels all day long. First of all, Kegels all day long is generally not a good idea for anybody, but secondly, it's not going to be helping you. So please stop and tell your healthcare provider, this is what I found. I can't really release my pelvic floor contraction. I feel like it's always tense and tight. They need to know that information. If you feel like you are too tense and too tight, then I actually want you to focus on releasing and letting go and focus on the posture as I described earlier. If you feel that you are able to tense and release, then go ahead and perhaps you can experiment with Kegels. They might help you. You can follow the advice of your healthcare provider, of course, but you might want to play with 5 to 10 Kegels at a time. See how that does for you. If you feel fatigued by the end, again, it should be a squeeze and lift and a full release. The other 2 exercises that you can do, a butterfly bridge and a ball squeeze. Now these will really help to activate the core muscles. So they are safe. If you're just not sure, you're thinking to yourself, I don't really know if I could release the pelvic floor or not. This Dr. Bree, I don't really know what she's talking about here. I think I can release, but maybe I can't. I'm not really sure. These next 2 exercises I'm going to show you will be safe. Again, ideally, you can contract and release the pelvic floor, but they'll be okay for you, even if you're not sure. All right, let's get started. The first one is called a ball squeeze. The second one is a butterfly bridge. They're going to be working all of the core muscles, the buttocks, the inner thighs, the pelvic floor naturally without even really doing a Kegel. They're going to be working all of those muscles. And the low abs are going to be working, the low back, all of the core is going to be turned on. So grab your ball for the first one, roll to your side, grab the ball, roll back onto your back, put the ball between your knees, and you are going to, as you squeeze the ball, you're going to exhale. The exhalation is key. You want to learn how to lift the pelvic floor and exhale at the same time. The inner thigh activation of this ball squeeze is naturally going to engage your pelvic floor muscles, strengthening them, but you want to exhale to activate your abs, to lift your breathing diaphragm, and make sure that those pelvic organs are in the right place and are not pressing down, okay? So you want to squeeze the ball and exhale. Squeeze it and then release. When you release, you can grab the ball with your hands, or you can just let your knees flop apart, letting the ball roll to the side. But then you have to get the ball every time. So play with this, see what works for you. Get it between your inner thighs, squeeze the ball and exhale. So squeeze for 10, exhaling 9, exhaling still, 8, 7, 6, keep exhaling, 5, 4, 3, 2, 1. Okay, let that ball release, kind of grab it down. Let those legs flop apart and do it 2 more times. All of this is to be supportive of strengthening the core and pelvic floor safely and helping not aggravate your prolapse while strengthening the muscles that you need to strengthen. So exhale and squeeze the knees together. Keep exhaling. Maybe a little inhale and then exhale again. And then release. Again, as you're doing that squeeze, you should feel a little something happening in your pelvic floor, a little bit of an engaged kind of sealing off of your pelvic floor muscles. Should feel very supportive of your pelvic floor and the prolapse. It should feel supportive, not like it's pressing anything downward further. If you feel that, stop. It's not working for you, it's not happening correctly, stop. So one more time. Ball between the knees. You're going to squeeze them together and exhale, one long exhale or multiple shorter exhales. Feel the pelvic floor lifting. All right, that whole time I was steadily squeezing the inner thighs together and exhaling. I did a couple of different separate exhales, but the whole time I was exhaling, really feeling the abs draw in and the pelvic floor, no downward pressure on the pelvic floor. If anything, it was lifting. Okay. So that was one exercise. Let me show you butterfly bridge next. So I'll remove the pillows and you're going to have your feet facing each other. The feet are facing each other. The knees are apart. And as you exhale, you rotate the inner thighs together and feet become flat on the ground, and you squeeze your bottom and lift your bottom off the floor. And now come down. Again, exhaling as you lift, holding it briefly, and then come down. Take it nice and slow and controlled. Keep going. And exhale. Keep going with this, and I'm just going to talk as you keep doing this move. What you're going to feel is that you are engaging your bottom and your inner thighs, the muscles that rotate your legs and hips inward are turning on, the glutes are turning on, the hamstrings are turning on. Everything is really turning on and firing in this area. Very supportive of pelvic floor health without you actually doing a Kegel, which, as we discussed, Kegels might actually be not the best thing for you at this point. It really depends on the person. So this is still strengthening all the muscles and the pelvic floor that need to be strengthened, but it's not doing a clench of the pelvic floor directly through a Kegel, which again may not be the best for you at this time, depending on your specific needs. So doing this is going to open and relax the pelvic floor. There's no downward pressure on the pelvic floor, and it's strengthening in a way that is going to be safe. That's the key. So again, if you do this exercise and perhaps the ball squeeze, those are two very safe exercises that you can do even if you're not 100% sure about the Kegels and whether or not they're effective for you at this time. All right, so stretch it all out. And when you sit up, roll to your side and press yourself up rather than jackknifing up. So again, keep in mind that the tips for the day are to, first of all, seek the advice of a healthcare provider. Talk to somebody about your condition. Talk to somebody about your concerns. And don't, if you think something's wrong, don't take, oh, there's nothing wrong for an answer. Seek the opinion of somebody else, because sometimes prolapse is missed. And if you catch it early, before it's too far advanced, then there's a lot you can do to heal it without, or prevent progression of prolapse without having to undergo surgery. So talk to someone about it. Secondly, focus on your posture throughout the day. It's super key to focus on your posture, whether you are just standing around, whether you're exercising, whether you're lifting things. Focus on that posture. Get it spot on so your pelvic floor is supported and your core is naturally in the optimal position for firing. Last, you can do the resting with your hips up on pillows to help release your pelvic floor and relax. And you can do the exercises I described to help strengthen the pelvic floor muscles and the core safely in a way that's not an isolated contraction of the pelvic floor muscles, in other words, a Kegel, which may not be a good thing for you at this time. I hope these tips helped you. I hope that you will seek help. I hope you'll know that prolapse is a common condition. Unfortunately, you're not alone. And I know that it can be a very emotional condition for some women. Some people can feel very betrayed by their bodies. They can feel betrayed by their healthcare providers who may not have caught it early on or may never have warned them that this could happen in the first place. It is common, it's emotional, but you're going to be okay. I just want you to know that. So many have been there. I have suffered from mild prolapse myself, but I was able to prevent it from progressing and even reverse what I had going on. I don't notice it anymore. It was soon after I had my son, I went running. 3 weeks after giving birth. Way too early. It was dumb, but I did it. And I suffered. So I was able to heal it. So there's hope. Just be smart about your needs, listen to your body, and seek advice from someone who can specifically diagnose you and help you through this. Thank you so much for watching, and if you want to have more inspiration and women's health information delivered to your inbox, sign up for my email newsletter, which is available on my website, FemFusionFitness.com. And you can definitely subscribe to my YouTube channel. You can always email me directly as well. So Brianne at FemFusionFitness.com. I am happy to help, and I hope you will take care. Thanks for watching. See you next time.